1. What is the first nursing action when a patient with heart failure reports new onset shortness of breath and orthopnea? Answer. Elevate the head of the bed and assess respiratory status. Rationale. Elevating the head reduces preload and eases breathing in left-sided heart failure, while assessing respiratory status identifies hypoxia per American Heart Association (AHA) guidelines. 2. What should the nurse do when a patient with heart failure has a weight gain of 3 pounds in 24 hours? Answer. Notify the provider and assess for fluid retention. Rationale. Rapid weight gain indicates fluid overload, a sign of worsening heart failure, requiring evaluation per AHA Heart Failure Management Guidelines. 3. What is the priority action for a nurse when a patient with heart failure has crackles in the lungs? Answer. Administer prescribed diuretics and monitor oxygen saturation. Rationale. Crackles indicate pulmonary edema, requiring diuretics to reduce fluid and monitoring for hypoxia per AHA Acute Heart Failure Guidelines. 4. What should the nurse do to assess a patient with right-sided heart failure? Answer. Check for jugular vein distension and peripheral edema. Rationale. Right-sided heart failure causes venous congestion, manifesting as JVD and edema, per AHA pathophysiology guidelines. 5. What is the best action for a nurse when a patient with heart failure reports fatigue? Answer. Assess activity tolerance and encourage rest periods. Rationale. Fatigue reflects reduced cardiac output. Rest reduces cardiac demand, per AHA heart failure care guidelines. 6. What should the nurse do when a patient with heart failure is prescribed lisinopril? Answer. Monitor blood pressure and potassium levels. Rationale. ACE inhibitors like lisinopril can cause hypotension and hyperkalemia, requiring monitoring per AHA medication guidelines. 7. What is the priority action for a nurse when a patient with heart failure has a BNP level of 800 pg/ml? Answer. Notify the provider and prepare for diuretic therapy. Rationale. Elevated BNP indicates heart failure exacerbation, often requiring diuretics per AHA diagnostic guidelines. 8. What should the nurse do to promote adherence to a low-sodium diet in a patient with heart failure? Answer. Educate about sodium content in foods and provide a dietitian referral. Rationale. Sodium restriction reduces fluid retention, and education promotes compliance, per AHA lifestyle guidelines. 9. What is the best action for a nurse when a patient with heart failure reports dizziness after starting a beta blocker? Answer. Assess blood pressure and notify the provider. Rationale. Beta blockers can cause hypotension, requiring evaluation for dose adjustment, per AHA medication guidelines. 10. What should the nurse do when a patient with heart failure has a heart rate of 110 beats per minute? Answer. Assess for arrhythmias and notify the provider. Rationale. Tachycardia may indicate worsening heart failure or arrhythmias, requiring evaluation, per AHA assessment guidelines. 11. What is the priority action for a nurse when a patient with heart failure develops sudden dyspnea and anxiety? Answer. Administer oxygen and prepare for diuretic administration. Rationale. Sudden dyspnea suggests acute pulmonary edema, requiring oxygen and diuretics, per AHA Acute Heart Failure Guidelines. 12. What should the nurse do to monitor fluid status in a patient with heart failure? Answer. Measure daily weights and assess for edema. Rationale. Daily weights detect fluid retention, and edema assessment monitors congestion, per AHA Heart Failure Care Guidelines. 13. What is the best action for a nurse when a patient with heart failure reports a dry cough on an ACE inhibitor? Answer. Notify the provider and assess for medication side effects. Rationale. A dry cough is a common ACE inhibitor side effect, requiring evaluation for alternative therapy, per AHA medication guidelines. 14. What should the nurse do when a patient with heart failure has a blood pressure of 90/60 mmHg? Answer. Hold antihypertensive medications and notify the provider. Rationale. Hypotension increases hypoperfusion risk, requiring medication adjustment, per AHA Heart Failure Management Guidelines. 15. What is the priority action for a nurse when a patient with heart failure has a potassium level of 5.8 milliequivalent/L? Answer: notify the provider and withhold potassium-sparing diuretics. Rationale: hyperkalemia risks arrhythmias, requiring urgent intervention, per AHA electrolyte management guidelines. 16. What should the nurse do to prepare a patient with heart failure for an echocardiogram? Answer: explain the procedure and ensure the patient lies still. Rationale: explanation reduces anxiety, and stillness ensures accurate imaging, per AHA diagnostic guidelines. 17. What is the best action for a nurse when a patient with heart failure reports swelling in the legs? Answer: elevate the legs and assess for pitting edema. Rationale: elevation reduces edema, and assessment quantifies severity, per AHA right-sided heart failure guidelines. 18. What should the nurse do when a patient with heart failure is prescribed furosemide? Answer: monitor electrolyte levels and urine output. Rationale: furosemide causes electrolyte loss and increases urine output, requiring monitoring per AHA medication guidelines. 19. What is the priority action for a nurse when a patient with heart failure has frothy pink sputum? Answer: administer oxygen and notify the provider immediately. Rationale: frothy pink sputum indicates severe pulmonary edema, a medical emergency, per AHA acute heart failure guidelines. 20. What should the nurse do to teach a patient with heart failure about daily weights? Answer: instruct to weigh at the same time daily and report gains over 2 pounds. Rationale: consistent timing detects fluid retention, and reporting ensures timely intervention, per AHA patient education guidelines. 21. What is the best action for a nurse when a patient with heart failure reports nausea on digoxin? Answer: check digoxin levels and notify the provider. Rationale: nausea may indicate digoxin toxicity, requiring level assessment, per AHA medication guidelines. 22. What should the nurse do when a patient with heart failure has a chest X-ray showing cardiomegaly? Answer: document the finding and monitor for worsening symptoms. Rationale: cardiomegaly indicates heart enlargement, requiring symptom monitoring, per AHA diagnostic guidelines. 23. What is the priority action for a nurse when a patient with heart failure has an irregular pulse? Answer: perform an ECG and notify the provider. Rationale: irregular pulse suggests arrhythmias, requiring ECG confirmation, per AHA arrhythmia guidelines. 24. What should the nurse do to promote activity in a patient with heart failure? Answer: encourage short, frequent walks and monitor for fatigue. Rationale: gradual activity improves endurance, while monitoring prevents overexertion, per AHA lifestyle guidelines. 25. What is the best action for a nurse when a patient with heart failure reports difficulty sleeping flat? Answer: provide extra pillows and assess for orthopnea. Rationale: pillows alleviate orthopnea, and assessment identifies worsening heart failure, per AHA symptom management guidelines. 26. What should the nurse do when a patient with heart failure is prescribed spironolactone? Answer: monitor potassium levels and renal function. Rationale: spironolactone can cause hyperkalemia and renal impairment, requiring monitoring, per AHA medication guidelines. 27. What is the priority action for a nurse when a patient with heart failure has a respiratory rate of 30 breaths per minute? Answer: administer oxygen and assess lung sounds. Rationale: tachypnea indicates hypoxia or pulmonary edema, requiring oxygen and assessment, per AHA acute heart failure guidelines. 28. What should the nurse do to assess a patient with left-sided heart failure? Answer: auscultate lung sounds and check oxygen saturation. Rationale: left-sided heart failure causes pulmonary congestion, detectable by crackles and low saturation, per AHA assessment guidelines. 29. What is the best action for a nurse when a patient with heart failure reports chest pain? Answer: administer prescribed nitroglycerin and assess for ischemia. Rationale: chest pain may indicate angina, requiring nitroglycerin and evaluation, per AHA heart failure complications guidelines. 30. What should the nurse do when a patient with heart failure has a low ejection fraction on echocardiogram? Answer: educate about disease progression and monitor for symptoms. Rationale: low ejection fraction indicates systolic dysfunction, requiring education and monitoring per AHA diagnostic guidelines. 31. What is the priority action for a nurse when a patient with heart failure develops paroxysmal nocturnal dyspnea? Answer: sit the patient upright and administer oxygen. Rationale: PND indicates severe pulmonary congestion, requiring positioning and oxygen, per AHA acute heart failure guidelines. 32. What should the nurse do to prepare a patient with heart failure for discharge? Answer: provide medication education and schedule follow-up appointments. Rationale: education ensures adherence, and follow-up prevents readmissions, per AHA discharge guidelines. 33. What is the best action for a nurse when a patient with heart failure reports a metallic taste on digoxin? Answer: check digoxin levels and notify the provider. Rationale: a metallic taste may indicate toxicity, requiring level assessment, per AHA medication guidelines. 34. What should the nurse do when a patient with heart failure has a sodium level of 130 milliequivalent/L? Answer: notify the provider and restrict fluid intake. Rationale: hyponatremia indicates fluid overload, requiring restriction and evaluation, per AHA electrolyte management guidelines. 35. What is the priority action for a nurse when a patient with heart failure has a blood pressure of 200/110 mmHg? Answer: administer prescribed antihypertensives and notify the provider. Rationale: severe hypertension increases cardiac workload, requiring urgent control, per AHA heart failure management guidelines. 36. What should the nurse do to monitor for complications in a patient with heart failure on diuretics? Answer: check electrolyte levels and assess for dehydration. Rationale: diuretics cause electrolyte imbalances and dehydration, requiring monitoring, per AHA medication guidelines. 37. What is the best action for a nurse when a patient with heart failure reports weight loss? Answer: assess nutritional status and consult a dietitian. Rationale: unintentional weight loss may indicate cachexia, requiring nutritional support, per AHA heart failure care guidelines. 38. What should the nurse do when a patient with heart failure has a new murmur on exam? Answer: notify the provider and document the finding. Rationale: a new murmur may indicate valvular dysfunction, requiring evaluation, per AHA assessment guidelines. 39. What is the priority action for a nurse when a patient with heart failure has a heart rate of 40 beats per minute? Answer: perform an ECG and notify the provider. Rationale: bradycardia may indicate heart block or medication toxicity, requiring urgent evaluation, per AHA arrhythmia guidelines. 40. What should the nurse do to promote fluid restriction in a patient with heart failure? Answer: educate about daily fluid limits and provide a measured container. Rationale: education and tools ensure adherence to restrictions, reducing fluid overload, per AHA lifestyle guidelines.